Hello, everyone, and welcome to today's Executive Web Forum, The Keys to a Successful Recovery Strategy, The Path from Crisis Management to Post-Crisis Sustainability by Open Minds Chief Executive Officer Monica As. My name is Meena Dai, and I am the Executive Vice President at Open Minds, and I have the privilege of working very closely with Monica every day to help specialty health and human service organizations across the country map a path to sustainability and growth in a turbulent market. In fact, we were behind the scenes a few minutes before we started today, and I was getting some great lessons, leadership lessons from farming and fishing from Monica, but I will save those and let her share them herself. But I am really thrilled that Monica was able to take time today to directly share her wisdom with all of you. And she's going to review what this next normal that we are in or that's evolving looks like, and what are the new opportunities in the market, and what the new business models are that are required to take advantage of these opportunities. And typically these Thursday web forums are reserved for our Open Minds elite members, but we did decide to open up today's event more broadly because we see the growing need in the field for help with a post-crisis recovery strategy. And so I will be happy to follow up with every one of you that's on the web forum today. I will send you an email. I will send you links to the recording from today's webinar and also Monica's presentation deck. And we'll also share with you information on how you can continue to leverage our full suite of resources and the strategic advice through membership and Open Minds. So at any point, feel free to send your questions in through the chat. There's a little question mark on the side of your screen. So if you just click on that, you can type a question in and send it to us at any time. Monica will try and get to all of them. And if we run out of time, we will be absolutely sure to connect with you offline to make sure that you get the answers and the resources you need. And now for most of you, Monica As needs no introduction. She is a thought leader who has been at the forefront of clinical management and technological innovation in specialty health and human services. And over the last 33 years, she has led Open Minds to become the go-to resource for market intelligence and strategy in the sectors serving consumers with complex and chronic conditions. And we have the largest proprietary market intelligence database in the field, and more importantly, a national team with more than 200 senior advisors, analysts, and subject matter experts. And Monica has led us to build this trusted brand, to develop long-time relationships, and to provide strategic expertise and an effective path to executive decision-making in the mental health, addictions treatment, IDD, and children's services markets. So, Monica, we are thrilled to have you with us today. I am going to go off camera and hand this over to you, but we will be back for questions later.
Great. Well, thank you, Meena. And I do want to first start out by welcoming all of our members to this web forum and tell you how much our entire team at Open Minds appreciates your business and the support of our work. It has been, I was just reflecting as we were preparing for this, almost a year ago today, we were launching our executive blueprint for crisis management. If you think about it, like many of you, our offices had just been closed. The early stages of the pandemic were happening, and we were going back to our files and looking at all of our crisis management materials from the 2009 crash, and updating them and refreshing them for what is a very different crisis, the crisis of the pandemic and its economic consequences. So roll forward a year, here we are a year later, and as you may have guessed, if you're a frequent reader of our work at Open Minds, we are now pivoting, like most of you, from crisis management to essentially, a strategy for success in the next normal. I will say over the past month, as we've seen the effectiveness of the vaccines, as some of the decline in hospitalizations and deaths out there, it's been the first time that recovery has really been a tangible idea. And so my remarks today, I really want to share with all of you the things we've learned and continue to learn as we're working with a wide array of groups on post-crisis strategy for sustainability. It's been an interesting few months. Personally, we're probably involved in 15 to 20 different strategic planning initiatives at any particular point in time. My goal today is to share with you some of the tips that you can take back to your own organization as you think about pulling together that strategy. So you know, how do we get from here to there? How do you go from crisis management to success in the next normal? I mean, it's going to be a very turbulent year. I was concerned reading the National Council survey that came out a couple weeks ago that looked at community-based behavioral health organizations, and a large percentage of them saying they thought they only had a 6-month runway for continued sustainability. And you see that repeated in hospital systems, primary care practices, other types of specialty providers. But as you're looking at leading your organization to success in 2022, which is, I think, when we will kind of fully be up in the next normal, there are really 3 questions that I want everyone on this web forum to be thinking about. These are the 3 questions that every executive team needs to answer. Number 1, you know, what does all this mean? What will be the lasting impact of the pandemic on what we do? You know, it's the age-old question, how will things be different? And we're going to talk about that in a minute. The other 2 is then, if you have an understanding of how the pandemic is going to change your revenue, your consumers, the payers that you work with, then the question is, how do my service lines need to change? You know, what I do for consumers that is paid for by health plans, what do I need to do differently to maintain competitive advantage? And then the third leg, the practical, tactical part of it, is really then to do that, how does my organization need to change? This is classic sort of Peter Drucker's strategic planning. It's the market drives strategy, strategy drives tactics and structures. But we're going to revisit this throughout the hour that we're spending together today. I did want to start with just a little bit of a reprise of what is it that keeps CEOs up at night, or most of you who are listening in. What are those factors that are shaping the market? There's still a lot of recovery unknowns. You know, what is the shape of the recovery? We hear lots of different predictions. We hear we're going to have a boom economy by 3Q. We hear we're going to have a K-shaped economy, and some people will recover and others won't. We are just starting to see the effects of the opening of the Affordable Care Act exchanges. The signups have been brisk, which means we're going to see a bigger shift of consumers that we serve who have a healthcare exchange coverage, which is markedly different. There are all the workforce issues right now. You know, kind of people's fear of return to the office, vaccination refusal, arranging childcare, you know, public support payments. I mean, the next 9 months, everyone is going to have a bumpy time, I think, from a workforce and team perspective, getting back to and figuring out what the next normal looks like. And some of those things, the last few items here, you know, important to the workforce, you know, what's the timing to opening of schools? What's the timing to opening of commercial enterprises? I mean, I'm sitting here on the square in Gettysburg, and the big question here, because most of the businesses in Gettysburg are not as fortunate as we are that they can operate virtually, they're all counting down the days to when can the tourist businesses, the restaurants, the tour buses, the museums be open in full capacity. And that's not unlike any sector of the economy that really involves the gathering of people as part of an economic enterprise. So these are some of the unknowns that every day, you know, executives monitor. Then we have other things to look at that I think have significant impacts. We've seen a big change, obviously, in the uptake of telehealth, and I want to point out 3 things. One of them is that in this time period in the past year, there are all kinds of new virtual behavioral health delivery systems that have evolved for both health plans and consumer use. So they present a significant challenge to traditional mental health and addiction treatment business as usual. We have a lot more home-based initiatives. On both sides, CMS and many payers have approved more services to be delivered at home. The flip side is we have a robust set of new organizations that are offering a wide range of home-based services. So, you know, the shifting of care to home-based, and it was not lost on me that in a recent interview, the analysts were talking about Amazon's move to provide telehealth services nationwide. And they said the Amazon move was predicated on their belief that most healthcare would move to home. I thought that was interesting and significant. And then the last big piece, I think, for the specialty provider market is that we're also seeing the widespread acceptance of virtual primary care, both by payers and consumers. And this has many implications for specialty provider organizations, both in terms of service line potential, but also in terms of referrals and marketing. So we have seen this, you know, kind of big picture change in terms of technology. This has also been a time period where investments in the health and human service space continue to expand. Investments in behavioral health, in mental health and addictions, in autism, in IDD, in the seniors population, in home care. I could go down the list of relevant subsectors of the health and human service market. There at this point is no end in sight in terms of the amount of investment money that's flooding into our space. And whether you and your organization are part of those investments, the market is going to be changed both in the short term and in the long term by this wide range of new players. Then we have, I call it the Juggernauts, the 4 organizations that I watch every day in terms of thinking about their impact on the field. And that is Amazon, CVS, Walgreens, and Walmart. These 4 organizations continue to expand with their investments in healthcare. And these are not, I like to point out and underscore, these are not cash paying only expansions. These are expansions that are being embedded in health plans. They do affect Medicaid, they do affect Medicare, and we're going to see some pretty wide market effects from these 4 organizations and their, not only the continued investment, but their very large footprint, which affects almost every community. If I remember correctly, I was reading an article about CVS, and CVS said they have one pharmacy within something like 5 miles of 90% of the US population, or some statistic very close to that, which I thought was incredibly striking when you think about the power of their footprint, not just of their services. So we have these, I would say, in a sense, out of industry competition in terms of services, who are all moving squarely into the service delivery space. Now, the health plans are in an interesting strategic position right now. At the start of the pandemic, a year ago from right now, health plan profitability was up significantly. People were postponing care. It was hard to get appointments, even if you wanted them. People didn't want to go in for services. So health plans really had a very profitable 2Q, 3Q of last year. That has changed. We now see both the effects of 2 things, more virtual care, so more services are being delivered. People who could not postpone healthcare services any longer. So the backlog of knee surgeries and other elective surgeries is now in the process of happening. So we have that, and health plans are now seeing the effect of the costs of caring for people with COVID. Both the acute care costs of people in emergency rooms and ICUs, but also what we don't know yet, the long-term costs. What are the long-term effects of COVID, and what is the tail in terms of the healthcare demands for services from people who have had COVID infections? So, as part of this, that's the health plan reality. They see tightening budgets going ahead, shrinking margins, and they're doing two things. And these are things that are very important from a strategy perspective. One of them is they are accelerating their move away from fee-for-service to a variety of value-based and alternate payment model reimbursement methodologies. So that's happening across the board, and we did see a relatively significant leap in the percentage of claims paid that are in some kind of value-based arrangement and in arrangements with downside financial risk. The other, and I think a trend that bears some thinking about, depending on where you are located, what kind of services you provide, is that the health plans are becoming, I like someone else's term, payviders. They are both providing health insurance, but they're also starting to acquire service delivery capacity in a fairly significant way. And the three that I think are leading the way, if you put aside Kaiser, Intermountain, and Geisinger, all who have been combined, have been payviders from the start. But CVS is now integrating their Minute Clinic investment into their Aetna insurance plans, and essentially doing two things: giving consumers big incentives to get services at the CVS health hubs, and also starting to create narrow network plans, which are much less expensive, that don't have benefits outside of the CVS footprint. So CVS is on their trajectory. Optum continues to acquire a lot of provider capacity, but it appears from the interviews with Optum folks recently that their big focus is going to be on acquiring primary care docs. They are right now the #2 employer of primary care physicians in the United States, second only to Kaiser. And their goal this year, they announced they want to add 10,000 new physician employees through acquisition or organic employment to their network. And then last but not least, I think most interestingly, Humana has started a separate division that is going to create over 100 new primary care centers. They already had some new primary care centers, largely focused on the 65+ market, but I think it will be an interesting footprint. So these are the sorts of changes that we're seeing that, depending on who you are, start to affect your strategic decisions, your competitive advantage, your sustainability. And I want to talk a little bit about what is it that we think the new normal is going to look like. Obviously, we're getting a strong preference for integrated care coordination, not necessarily service delivery, but integrating the management of services for especially consumers with complex needs. Something I think we have to factor into our plans is that virtual on-demand services, which are fairly low cost, think $45 to $50 an hour, are going to become the primary delivery model for mild and moderate conditions of all types. Whether I'm talking about I need a consult for my sore throat or I'm feeling mildly depressed, there are going to be a lot of options for me as a consumer to go online and get services for those things rather than going to traditional provider organizations. Part of what we've talked about a lot is that the future looks hybrid, that the expectations of consumers and health plans is that provider organizations will be able to serve them seamlessly in some combination of virtual and face-to-face services. I think the big news is if you run a facility, we're also seeing that transition to hybrid. There's been a big growth in virtual home-based addiction treatment, in home-based long-term care, and certainly in the hospital at home initiatives that have come up from CMS and look like they're going to be continued going forward. And these things are fundamentally changing the competition for consumers in the addiction treatment market, and certainly in long-term care, whether we're talking about the seniors population or populations with special needs. There's a lot more competition. I forget the exact number, but I think just to give you a flavor of it, there were over 700 new mental health startups last year. That's just mental health, not addictions, not autism, not IDD, not primary care. So lots of new entities, many of whom will fail, but in the meantime, they will be out there competing for consumers. We talked about the payvider issue. I think we are going to see a lack of price sensitivity now through probably 4Q of this year. But as we move into the fourth quarter, as the, let's just say the effects of the American Recovery Act, we've had 5 federal relief and stimulus bills passed by Congress. The most recent one, the American Recovery Act, most of the effects of those 5 bills are going to run out from a market effect by the third and fourth quarter of this year. So we're going to see at that point, I think, a pivot to much more price sensitivity, and with that, more risk-based contracting. And then last but not least, I think we are already seeing all of these changes mean that economies of scale, your size does matter in terms of organizational service delivery, your ability to invest in tech infrastructure, your ability to compete for executive talent, and your ability to compete for frontline talent, your ability to amortize costs and keep unit costs low. All of those things are kind of big factors. Now, before we pivot to talking about, kind of, here's from the lay of the land to what do we do, I did want to say one other thing about the effect of technology adoption in the pandemic and how it has changed, I think, the baseline for competitive advantage. In our view, and we've looked at a lot of markets at Open Minds and done a lot of surveys of consumers and health plans and all kinds of stakeholders. And there seemed to me to be the effects of technology, which has really ramped up in the past year, have really changed the basic expectations of our stakeholders. Consumers have come to expect easy and convenient, online scheduling, on-demand services, the hybrid model, your ability to pivot from telephone to text to email. They want customized services in terms of a CRM-like customer service interface. They want personalized care using their data for decision support. So the pandemic has changed consumer expectations a lot. It's also done some, I call it, driven new price point drivers. The competition and the use of technology is going to have an effect on what health plans and consumers, by the way, are willing to pay, both for units of service, for case rates. And the expectations that we see is there's an expectation for the automation of administrative functions, for the use of technology and remote monitoring, for the use of route optimization software for dispatching community-based workers, for predictive analytics to reduce unnecessary spend. These have become, in some ways, not necessarily an option, but a baseline in sort of that expectation of the customers of what they get when they seek health and human services. So let's pivot a bit to talking about the new strategy, and what this means and what does this look like. So I think there are a couple results of these market changes, of these 3 market changes. And one of them is that the demand for many traditional types of services are going to decrease. And on top of that, the price point for a lot of traditional services is going to decline. This is not unusual in any market, but we're going to see, I think, a pretty pronounced effect over the next 12 to 18 months. And organizations and executive teams are going to need to think creatively about what they need to do differently. Going back to my 3 questions at the beginning, we've answered the question sort of what's going to change in the market. The next question to be answered, and it really is directly related to this, is what are the services that I need to do differently? What are the new services that I need to keep my customers, to keep my consumers, to keep my health plan contracts, to keep my referrals, to keep my revenue? That's the big pivot question right now for every organization, but we're going to talk specifically about organizations in the health and human service space. So I'm not negative about the future of health and human services. I think there are lots of great opportunities out there. And the four that are tops of my list are, the needs of consumers, the needs of the most complex consumers are not going away. And it is true that most of the effect of the technology and some of the new competitors is going to focus on the consumers who don't have, I would say, the most deep end needs, including consumers in Medicaid and Medicare. But the needs of those complex consumers are going to continue, and advantage is going to go to organizations that can develop center of excellence treatment models, crisis and readmission response programs, integrated care coordination models. I mean, these things will continue to be in high demand. They'll just look slightly differently. There is a market for primary care for consumers with complex needs. They are currently underserved and poorly served by the traditional and new virtual primary care options. There's a wide array, a tremendous amount of opportunity for home-based everything. As we see this shift, I think a permanent shift of more services being delivered in community-based settings that are not a clinic. The options for developing those are big. And then I don't know, I still believe that come the end of this year, we are going to have a bit of a housing crisis here in the US due to the economic instability. So there will also be, I think, a robust market for services that are really tailored to people who have housing insecurity. So these are just a few of the areas, but these areas have tremendous potential. But I think the big question is how to get there from here. And I like to think it's the 1, 2, 3 approach to building great strategy. You need to do a good job on your strategic plan. Contrary to what some people tell me, the market is shifting too much for a strategic plan. I would argue there has never been a time where organizations needed a strategic plan more, realizing that that plan may need to pivot. But it's, you need a plan. You need to accelerate innovation and bringing things that the market wants to market at scale. And you need to work diligently at improving value. And to me, these are the 3 pivot points over the next year to going from crisis management to success in the next normal. The planning part is everything you would think. These are my list of questions for every executive team. I encourage you all to take this slide and embrace this discussion with your team. What's your vision for market position in the post-crisis period? What are the services that are going to anchor your margin and make money? As you look at your portfolio, what do you need to add and what do you need to terminate? And once you do that, then it's figuring out, to use the Peter Drucker analogy again, if we understand the market, we've developed strategy, then what are the structural things we need to do? What are the competencies that we need to develop? Are we big enough to execute our strategy? How do we compete for talent? This is a cascading process going from mission and vision, market positioning, service line portfolio, and then pivoting to the tactical and structural pieces. Just a few notes. This is not the day that we're going to go through our, kind of best practice strategic planning model, but those documents are available on our website. You can download them. It takes you through the 4 phases of planning, kind of your own strategy cookbook. I just like to point out a couple things about kind of, I think, the Open Minds philosophy about strategic planning. And that is that the best strategic plans are plans that are really driven by data. So if you look at the left-hand side here of this chart, it really is, understanding your organizational performance. How do health plans perceive what you do? What are your access measures? Do consumers like their experience that they get? What are your clinical outcomes? What does your financial stability look like? And how do you compare to the competition? That is the bedrock of thinking about strategic planning and market positioning. With that, kind of understanding your vision and mission in the market, you can develop strategy then to get you, I like to think, to the next normal. here's what we need to do to pivot and build on from where we are to where we need to be. And then, the biggest part of strategic planning, and it got to my column I wrote a couple days ago, it is really incredibly boring at that point. It's all about implementation. It's all about performance management. It's the nuts and bolts of great managers, which are setting the strategy, setting the performance measures, and then working diligently with their teams to make that performance happen. So think of, the framework here is that. I do want people to think about, I want to pivot a little bit to talking about what do we need to do that's new? How do we replace revenue or margins that look like they may go away or severely decline over the next 5 years? And I like to think that there are generally, for most organizations serving consumers who have chronic conditions and complex needs, there are kind of 3 strategic market positioning options. And by the way, an organization can do more than one of these, but you need to think carefully about the market segmentation that's involved. One of them is a cash paying market niche. If you have a great specialty in the right geography, there is a robust, small but robust cash paying market out there. The second is the center of excellence approach. State-of-the-art service for hard to treat severe conditions and consumers with very deep end needs, and being able to document, kind of superior outcomes with a targeted group of consumers. And then the last is preferred health plan contracting. And the reason I've laid out these 3 buckets is as organizations start to think about what they do well and taking, I hope, a strength-based approach to how do we build a new service capacity for the future? I think it's important to be thinking about these 3 general types of market positioning, because in the end, they involve very different consumers, they involve very different construction of how services are delivered, and very different marketing investments for these 3. So with those 3 options, I think it's, the big question everyone has is, all right, I want to do something new. What's my next big thing? How do we come up with what that is? And we really have put together a framework that I hope you'll take back with you and use as you go from here's our strategic plan to here's how we're going to operationalize our need for innovation, our need for diversification or service line extension. And there are really a couple very basic steps, and they sound simple, but they are, I would say challenging for executive teams to implement. The first is you need a framework for new service line development. I would say we have passed the point where for most health and human service organizations, the traditional approach has been we're going to have this sort of organic service line extension process where managers who are busy managing are going to have extra time to do new service line development. I would argue that that is fine for a more stable and slowly changing market, but we're looking at something that's a bit disruptive and probably the need to introduce new services faster. So I think, first of all, if you think about kind of the 5 steps of the framework here, you need a framework for market intel. You need to be able to track what customers want, both consumers and health plans, track what competitors are doing, know kind of where you fit in the market, both now and in terms of your future plans. You need to develop a process for testing service line concepts. If a health plan comes to you and said, I could really use X, what does your organization do with that? You should have a standard process for conceptualizing the solution, feasibility analysis, so that you can either, I like to say, rule in or rule out quickly your level of interest in doing this. You need some cross-functional team with dedicated managers if you decide to develop something new. You should use a standard service line development process, and those, again, things you can download from our website, but there are a number of different processes. The important piece is to standardize that process so you can essentially move along the development path more quickly. And then the last piece is, and I think this is often overlooked, is whatever you decide to do that's new, what you want is essentially a formal plan for how you launch. How do we test the concept? How do we develop a pilot to actually do real world testing? And then lastly, what's our plan for scaling this? One of the, I think, big impediments, and this is more the case in nonprofit organizations in the field than for-profit, is that nonprofit organizations tend not to think as much about how do I take something that I do that's really good and scale that up in terms of both volume, in terms of volume of types of consumers, volume in terms of type of geography, payers, so the scaling part. But you want to create a framework of how we're going to accelerate kind of that new service line development. And then there's really just a very standard process for identifying market gaps. First, as I said, you need to know what your own stats are. Who do you serve? What are your performance metrics? What service lines are profitable? What's your current consumer and payer mix? In large part, to be able, this is a fairly common question that I like to ask executive teams. What do you do right now that you do well and make money that we could expand? But you want to have this, you need a framework for where we're at as you start thinking about responding to market gaps. Then the next best, course of action is to actually talk to potential customers. And largely, if you're thinking about solutions that are focused on centers of excellence or health plan preferred contracting, that means talking to payers. If you're doing a cash paying service of some type and that's what's in your pipeline, that means, consumer focus groups, talking to referral sources, whatever you're thinking about, you want to be thinking about how do I interview current customers and get their sense of pain points, what they think of us, what they think of the competition. From those interviews, you can come up with a laundry list of here are the possibilities. And usually, if you have a creative a clinical team, that laundry list is going to be really long. But it's good to say, here are all the possibilities, here are the ideas from our staff, here's what we heard from our payers, here's what we heard from consumers. And then what you want to do is actually use a process to prioritize those potential new service lines. Use a standardized evaluation and ranking system. This is not rocket science, but it forces some discipline in terms of rule in and rule out to the process. Once you've winnowed down the 1,000 great ideas to 12, then it's really doing high-level feasibility analysis. You're building, I would call it the mini business plan. What's the service? What are the cost assumptions, revenue projections? What does break even look like? How long would it take you to get there? So you can start to rule in and rule out different service line opportunities. And then last but not least, here's the last step is really then selecting service lines when you finish the feasibility analysis is to select service lines for development. I think the key to this is to do this rapidly and to fail fast. What you want are a lot of things in the hopper. You want to inexpensively rule in and rule out along the way. And even when you get to, we use a service line development process, a 7-stage process that we call the stage gate process, because it is heavily weighted up front with the things that are least expensive. And as you move through each of the stages, you're doing more and more of an investment. The reason we've organized the service line development process that way is along the way, if you find something that indicates you're probably not going to be successful, you don't want to continue. You've got to not fall in love with your service line. You need to terminate what you're doing and put those resources into something that has, bigger legs, so to speak, for kind of that market evolution. So it's a fairly, like I said, this is a fairly simple process, but one that demands a lot of executive team discipline to put in place and to manage over the course of a relatively short period of time, as we look at thinking about starting now and having things that would be up and running in, right around the corner in 2022, a mere 9 months from now. Once you select those new service lines, just a couple thoughts about functionality. One of them is use digital as the starting point. I mean, whatever it is that you're conceptualizing, hopefully you have tech savvy executives who understand what all the different technology options are out there in terms of what apps can we use, what automation, what care management software, what HIPAA encrypted texting, what EVV documentation technology, all of those pieces way beyond EHR and telehealth, which are just assumed to be the basics. But you want to be looking at how do we deliver this service using the leverage of as much technology as we can, and why? Because typically embedding that technology in your service design is going to decrease your cost and increase a lot of the features that customers, both consumers and payers, find most attractive. So digital is the starting point. I always encourage people in crafting a new service line to think about new payment models from the start. There are lots of things that won't pencil out in a fee-for-service environment. So you want to, you may at the start have to have a pilot program where you're reimbursed on a fee-for-service basis, but you want to be thinking about new payment models, performance guarantees, performance bonuses, case rates, bundled rates, capitated specialty populations right from the start. And then the last two things are more practical in terms of service line development. Upfront, you should be thinking about how do we test to know this works? That's a proof of concept. Who could we find that would agree to participate with us in a pilot? That's when you're looking at taking that new service line. You've proved that it works. Now you want to look at it in a real world environment. And then lastly, if this really does pan out, what's our plan for scale? Is this a regional service? Is this just one city? Are we limiting it to a specific group of consumers, or are we going to try to expand the consumer base? You want to be asking those questions up front. And then the acid test, the very last thing is, before you get to the marketing phase, before you get to pilot programs and outreach to payers or consumers, it's really doing the return on investment analysis that we can pencil out and show, here is the likely benefit, financial benefit to our customer of our model. And that may be improved outcomes. It could be fewer hospital days. It could be moving a percentage of care from residential facilities to home, whatever the metrics are. But these things, digital as a starting point, thinking creatively about reimbursement models, planning upfront for both proof of concept and scale, and customer ROI are kind of ingredients that you want to bake into your process as you think about launching a new service. So a couple questions. One of my colleagues, was looking at my presentation and said, what about the digital divide issue? What about consumers' preference for non-virtual services? I think those are both very relevant in your market research, but they are very different. I think, like all things in our economy, the trend towards using more technology is going to exacerbate the digital divide and the educational divide. I mean, it's we see this all the time. It's not lost on me that my mother-in-law struggles greatly, who's in her 90s, to participate in a lot of Medicare benefits in her Medicare plan because they are based on a computer and she doesn't have one. And and is, sort of reduced to using the telephone option offered by her Medicare health plan. I don't think that's going to go away. And I think what we need to do, we need to think about accommodation for social factors. And one of the things I do see coming is we move to more value-based reimbursement. And we had a great presentation by Banner Health at our Management Best Practices Institute a couple years ago, is that for some populations, they were giving consumers smartphones and essentially communication access in order to include them in their care coordination initiatives. So I think we have to acknowledge that this trend is going to exacerbate the digital and educational divide, and we need to think proactively about how to address that. Both there's the mega policy issue, but practically, for our market, for the consumers we serve, what do we do? Consumer preference for virtual and face-to-face services is, to me, a completely different issue. I think that this is going to be sorted out in terms of return on investment and in terms of ability to pay. And let me just digress slightly on both. I think we don't know yet what are the particular types of consumers and consumer issues and situations that are best addressed face-to-face versus virtual. It's going to take us a couple years of getting enough telehealth information to actually answer that question. And I think as we learn more about that, as we learn that for particular types of consumers, a face-to-face visit is going to divert an emergency room presentation, whatever the math is, we will make different choices as a healthcare provider and a health plan about who gets face-to-face services just as part of protocol. I think that's going to be different than preference. And we're already seeing, and I'll give you two examples of this, kind of preference change in the market. If you belong, the current health plan I belong to now makes available to me at no cost several virtual mental health options. So I can get mental health services via phone or computer. I don't pay co-payments or deductibles for those services. The flip side is, if I decided I wanted to see a social worker face-to-face, I will pay co-payments and deductibles for those. I think that requirement that I pay more to exercise a face-to-face option is going to not only continue, but become standard. The other place we're seeing that is in the new health plans with virtual primary care. Essentially, if I agree to virtual primary care, I pay for several of the plans, not all. I pay a much lower premium per member per month as a subscriber than I would if I want to retain a face-to-face relationship with a primary care doc. I'm not saying these changes are good, but because I'm sure there will be comments to that effect. I'm just saying that this is what we're seeing, that I think it will be incumbent on health plans and provider organizations to address the digital and educational divide. It will be incumbent on provider organizations and health plans to determine which consumers do we want to invest in more face-to-face visits because we have better health outcomes from that. And then the flip side is, where that's not the case, I think we will continue to, I would say, have a differential payment for people who want to exercise their option to use more expensive face-to-face services. So those are all things to be thinking about as we look ahead. Then the last piece, and sort of in closing, we talked about how do we get there from here, and I said there was this three-part plan. There's coming up with a transformational strategy for the next normal. How do I address those three questions of market change, portfolio mix, and portfolio implementation? There's a fairly structured process that any organization can adopt that is really talking about how do I innovate, how do I create new services, a competency that all health and human service organizations need to get better at, is the speed and increasing the speed and reducing the cost of new service line development. And then the last piece is this, improving value, using a metrics-based approach to monitor and improve our organizational resilience. And I tend to think of this in a few domains, that, the strength of our service line portfolio. Do we know what's growing and not, what makes money and not? Is our diversification, our payer mix diversification, or geographic diversification in balance? What's the strength of our relationships with customers? What is our skill in managing alternative payment methodologies? How good, one of the big questions we didn't get time to talk about today, but how good is my organization at virtual marketing? Because that's where we're headed. One of the byproducts of this shift is that more referrals are going to come virtually than through traditional face-to-face referral generation. What's the financial strength of my organization, and what's our ability to innovate and respond to market opportunities? These are the domains that you want to be thinking about in terms of kind of monitoring for improving value and improving the resilience of your organization. So I see this as kind of the wrap-up: market-oriented strategy, digital-first service line development, thinking carefully about the virtual marketing push-pull function that we want to put into sign contracts and pull consumer and referral sources. These are the, I think, ingredients, getting back to our title for today. How do we shift from crisis management to essentially sustainability in the next normal? It's really following this very structured path from strategy to implementation. And just to quote Walt Disney, because this is, I think, a great way to end our time together: the way to get started is to quit talking and begin doing. I think it's really motivating our executive teams, and from them, our management teams and staff, to be thinking about this three-part adventure as what we need to do to continue providing great service for the consumers we've always served. And with that, I want to thank you very much for your attention this afternoon. I don't know, Mina, if we have any questions. I just want to check in before we wrap up for the day. And I encourage you right now, if you have questions, just type something in the question box. I'm happy to provide an answer if I can.
Wonderful. Monica, thank you for that great lay of the land, and thank you for telling us what we do with all of it, right? It can be pretty overwhelming. And my big takeaway is these are changes that were coming anyway, and definitely the pandemic has accelerated and has given us the urgency of being able to pivot and adapt quickly, but it sounds like this is the way the world was headed in anyway, right?
I think, Mina, that, and I forget the name of the marketing professor at NYU who just wrote a book on this. His view is the pandemic has accelerated some trends, and not just technology, the focus on home, by about 10 years in a single year, which I thought was a very interesting perspective. There's nothing new, it's just faster.
Wow, thank you, Monica. And can you talk a little bit about, you mentioned how critical data is, right? Becoming a data-driven organization is for success with any strategy. How do you get started if you are getting into this for the first time? If you want to look beyond just your financials, what are some key performance indicators you should establish, and how do you start down this road?
Well, I think this is the job of an executive team. I think the executive team needs to get together and understand, here's the question I always ask: what is the data we need to develop a new strategy and then monitor whether or not our strategy is successful? And it comes, Mina, I've done so much of this. Many times people don't start that process because it looks overwhelming. I keep saying you want to start with, here's what the perfect world would look like, and then look at what you already have that you can start to use as a regular dashboard or performance report, whatever model. But and for a lot of organizations, that starts with things like billing data or EHR data, or data in their HR system, the financial data, things that are easy to access. But you can build a metrics-based culture even if the reporting, even if your dashboard isn't perfect. What you want to do is start building the use of data in making decisions, and then adding to that capability both the richness of the dashboard, but also the ability of your staff to proactively use data. So I don't know if that answers your question, but it really is, my view is, don't let the perfect, don't let the perfect get in the way of, actually getting something done. You want to get started and build on that.
Great, Monica, thanks. Harold, I hope that answered your question. It was a question from one of our attendees, and I'll be happy to send you some more resources offline as well that Open Minds has about, where you get started and the different paths to becoming a data-driven organization. And Monica, we might have time for one more question. This question is from Clara. Can you talk a little, you mentioned proof of concept, you mentioned as we're thinking about these drastically new business models, about going into maybe doing a pilot. Do you have a recommendation as to how long you should give something with the rapid development of new service lines you're talking about? What does fail fast mean? Do I give it 3 months, 6 months, 2 years?
Well, proof of concept can be relatively quick because, so let's talk about proof of concept versus pilot, and then scale. Proof of concept can be relatively quick. If you come up with a new approach to dealing with depression in children, just using that as our example, which is some combination of technology-based tools and online intervention and group sessions, whatever that model is. The proof of concept is putting that package together and offering it to a group of consumers who would either pay for it or not. I mean, you may do it as an unpaid test. But what you want to show is, does the model hang together? Does the service work from a consumer perspective? You might look at early endpoints in terms of performance. Does it appear that it's going to be clinically efficacious? You won't know everything in a relatively short period of time, but you're talking about 2 to 3 months to kind of prove that the concept works. From there, you're ready to pivot to what I call the real world experience. Could you find a health plan, a county government, jail, a jail system, whatever the user group is, who would agree to actually let you run a real world experience using your new service model? And you want to design that up front to actually gather data so you can demonstrate outcomes, you can fine tune the consumer experience, you can fine tune the clinical workflows. Those pilot programs tend to be longer. It doesn't mean that you can't start marketing the program at the same time, but what the pilot program does is it gets you an initial customer that you can use. It also allows you to fine tune what you're doing so you can, before you sign customer number 2, work out some of the bugs in the process. And then last but not least, and this is always the danger, you could get a few months into the pilot and decide this isn't going to work and decide you're going to close the entire service line. All of these things, the proof of concept and pilots, are really opportunities to test what you're doing without putting the full investment and expansion in them. So, and we've got quite a few resources on our website about this, that if you're interested in more detail, just shoot an email and we're happy to send them to you. But it is that being used to going from idea to scale more rapidly is what I think most organizations are going to need to do, and that means the design process, feasibility analysis, testing, service line development, proof of concept, pilot, and scale is kind of the process. We want to compress that into a shorter period of time, including the decisions whether to continue or whether to scrap the whole idea and move on to something else.
Great, Monica. Thank you so much. And thanks for reminding our attendees about the other resources. As I said at the beginning, I will send out a link by email to all of you as soon as this recording is posted and accessible to you online. And we also have a toolkit with a framework for strategic planning that Monica and the team of experts have put together. So we will share all those links with you. And we also have more on the step-by-step of new service line development. So we'll be happy to tell you how to get access to all of that. And we invite you to join us next week for our web forum on how your organization is dealing with vaccination among your workforce. I'm sure that's a question that's very much on all of your minds. So join us and hear some interesting case studies about how other provider organizations are dealing with the same challenges that you are. So we we'll send you a link to sign up for that as well. But we definitely hope to see you back. We'd love to continue to talk with you about how open minds can be helpful. And with that, I want to thank you all for being with us today. And Monica, thank you once again.
Nope, thanks to everyone who attended, and we'll see you next week, same time for our next Executive Web Forum.
Bye, take care.